And I feel very grateful to all of you who have made time in your busy day to come together and discuss a really important topic near to my heart is really how can we create trauma-informed cultures where we can shift from burnout to balance. I have prepared a deck, so I'm going to share. Fingers crossed, I share the right screen. So holding my breath to see if I'm sharing properly. Great. I see a thumbs up from Carissa. And I'm going to try to advance the slide. Bear with me. Great. For some reason, the slide is not Oh, there we are. I had a little panic there. But welcome, everyone. In the time together today, I would like to, engage in a dialogue on creating trauma-informed culture change to help us kind of shift from burnout to balance. And the objectives in our time together over the next hour or so, I'm going to, in the course of about 40 minutes, because I'd like to leave about 20, 15 minutes for open dialogue and discussion. I'm going to cover kind of three objectives. The first is understanding how trauma-informed principles can enhance psychological safety and well-being for care workers and why these approaches matter to sustain workforce health. Second objective is to examine how specific leadership behaviors, organizational policies, and norms can strengthen and sustain and model a supportive trauma-informed culture. And really what I mean by a trauma-informed culture is a culture of healing and safety for everyone and using concrete kind of methods and frameworks, especially implementation tools, to embed trauma-informed values into organizational practices, especially in healthcare environments, which has unique challenges. And then the third objective is helping us to build capacity to recognize the critical drivers and the steps, the concrete kind of actionable steps we need to build and maintain responsive, resilient, and essentially psychologically and emotionally safe workplaces by aligning with trauma-informed approaches. So I hope in the short time I'm able to do a bit of a kind of walk through these three objectives. So in terms of our time together, I'm going to provide a background and overview of, what is meant by trauma-informed approach to support psychological safety in the workplace. I think this is really important in terms of level setting and using a common definition of what we mean by trauma-informed culture. Then I'm going to talk about key frameworks and really kind of tangible organizational tools that can be actioned to support a trauma-informed culture. And then I'm really hoping to save some space, so 15, 20 minutes where we can just open it up through the chat to go into a nice organic dialogue and discussion on this topic. So just to kind of warm us up, it's a poll question, just to see who's in the room today, and if you can take a few seconds to complete the poll, it gives us a sense of who's in the room today. So I'll let Carissa help us with the poll.
Sorry, if you could just put it in the chat, that would be great.
Oh, yes. Please put it in the chat.
So I
Oh,
see
sorry.
caregiver, healthcare, social worker.
Wonderful.
Lots of caregivers, community worker, manager.
Wonderful. I'm going to see in the chat. I'm looking at the chat. Oh, it's so good to see family caregivers and case managers based in an emergency shelter, mental health support worker, HR coordinator. I'm so glad you're here. Educator for long-term care, director, other and caregiver for my family. I'm so thrilled to see the many different hats that people are wearing in our space together. Mental health coach and peer support worker, amazing, amazing, amazing. Um, Manager, and we'll talk about the essential role of managers and leaders in creating this culture of care. So, and researcher, educator, caregiver, supporter, coach, and I love that because um, bringing our whole selves means we wear multiple hats and we just don't wear one hat. And so I love to see that. Thank you everyone for putting that in the chat. We really appreciate it. And it really gives face to the people that we are convening and dialoguing together. And so just straight into kind of the objectives, I thought it'd be important to provide a background and overview of trauma-informed and equity promoting approaches to support psychological safety, so that we can create systems and cultures of care. And so just by way of like background, I feel like I'm preaching to the choir, but psychological health and safety, especially in care work, healthcare, is really significant because the evidence is clear. Care workers are 1.5 times more likely to be off work due to psychological distress. 40% right now report feeling burnt out, and that is directly work related. 50% intend to leave the profession. And right now, without the healthcare workforce to provide the backbone care that people, including us, we are part of the community, need, we just don't have a healthcare system. And only 60% of healthcare workers are satisfied with the quality of care they're providing. And this speaks to moral injury and moral distress. We're talking about a group of workers who want to do their best, who want to essentially care for people and are having moral injury and moral distress because they're having confliction between the context of the environment and their values. We all know the key challenges that the healthcare workforce faces, but the pandemic, which is not long ago, I know that it feels distant, but it actually is very recent, really came to highlight and expose the tipping point in terms of the challenges faced by frontline care workers. And in that kind of context, exposure to risk is very close and proximal to health workers' concerns. Another one is extreme workloads, and moral distress and dilemmas that come in the way of providing care work, and constantly kind of at the interface of needing to adapt to rapidly changing work environments. And so the main thing is, so what now, right? What have we learned? What from all of this, where do we go from here? And the media was really hot on this item. Many reports came out just as during the COVID and just after, kind of highlighting the fire, which is, we have a healthcare workforce that is under psychological distress, burnout is rampant, and 75% of Canadian nurses reported just being burnt out. And this is kind of hot off the heels of the pandemic. In recent surveys, the Montreal Economic Institute released a report just 4 months ago, and things are not much better. In fact, a large proportion of new grads, nurses, are intending to not stay in the profession, and burnout continues to be widespread across healthcare workers, beyond nurses, just across the board. So, which brings us to our next kind of interactive question. I know we're wearing many hats, but all of us, whether we're managers or HR or peer workers, caregivers, how many of us here have experienced burnout uh, in our journey. And so if you could please put in the chat once, 5 times or more, or never. So I'll look at the chat. Twice, 4 times, a few times at least, once, 3 times, at least 5 times, at least 4 times. Extreme burnout for years. More than once, at least twice. And so, yeah, please put it in. I don't think anyone, I've done this twice and I've never seen somebody say never. And so I think, just between our real lived experience of sharing within this forum in this chat, it's evident that the research resonates with reality. And I've been a practicing nurse practitioner for a decade, a nurse for over 20 years, and I've experienced burnout at least 4 times. And so that is a real reality. And so thank you everyone for sharing and participating in the poll. It just really brings to life the reality that burnout is really, truly a workplace hazard that's common in healthcare. And so we can't just put a Band-Aid on it. We need real structural levers and an organizational approach. Which brings me to next slide, which is you coming to a common definition of burnout. I think this is really important because, sometimes we're thinking we mean the same thing when we hear burnout or even trauma informed, but sometimes we might not be coming from the same definition. So really quickly, in the chat, first thing that comes to mind when you hear the word burnout. And there's no right and wrong. Just put in, don't overthink it. Just first thing that comes to mind, first word that comes to mind when you hear burnout. Just one word. And the very first one. Unsafe, exhaustion, giving up, unsupported, depressed, drained, mood changes, mental fatigue, scared, alone, anger, needing help, emotional, desensitized, functionally depressed, loss of sleep, done, checked out, too much to complete, at the limit. Yep, keep them coming in, overwhelmed, and no more. And so the words that are coming up in the chat really capture viscerally how burnout is felt mentally and emotionally. And just kind of coming to a common definition of what burnout is really helpful, especially in organizations, so that everyone has the same understanding. So the number one thing about burnout, the official definition, is that it is an occupational phenomenon. So it's not a personal flaw. It's not a mental illness. It is related to work. And it's a syndrome resulting from chronic, unmanaged workplace stress, characterized by 3 dimensions. First is exhaustion. So a lot of that was captured in our chat. People were saying exhausted, done. The second kind of dimension is cynicism, like negativity toward work. And third is ineffectiveness. So a very reduced sense of professional accomplishment. So you can see from this definition, it is very clear that burnout is not a personal flaw. It is not a mental illness. It is really a syndrome with 3 defining dimensions specifically related to occupation, workplace. And so this is experienced on the personal level as a state of emotional, physical, and mental exhaustion, which you beautifully captured in the word cloud. And it can reduce productivity, motivation. And burnout isn't a medical diagnosis, but it's a response to the conditions of work And why this definition is so critical is that if the root cause to burnout is occupationally linked and is a response to the conditions of work, then the solution lies at addressing the conditions of work. And I think this is really important because it lifts the burden away from the burnt out staff member or individual to a collective structural understanding of workplace safety. Now, health and safety in the workplace. Well, a healthy and safe workplace is where workers understand their roles, believe that they can contribute to decisions about how their work is carried out, and we have a national standard in our country. It's the National Standard of Canada for Psychological Health and Safety in the Workplace, which outlines concretely a systematic framework that employers can use in creating and sustaining a healthy, safe workplace. And so, you'd be surprised how many, I work in the health sector, as many of you do, that many people are unaware of these national standards. And it's mind boggling because my partner's an engineer and not in the health sector. And his workplace, they're all about the national standard. So it just gives you, I was like, oh my God, I can't believe the non-healthcare sector is more aware of these standards than we are. And so what comes to mind when you hear psychological health and safety in the workplace? And please feel free to use the chat. I'm going to try to see the chat.
Safe, respect, getting enough hours off work, wellness.
Yes. Recognizing limits. Performative. It can be performative. Support, breaks, fairness, feeling comfortable expressing differing opinions. So important. Being allowed to hold boundaries, access to mental health care, inclusivity, having a reasonable workload, feeling safe and heard, an open door, fairness, mental health days, and trust. So these are powerful words that come to mind when you think of like what makes a psychologically healthy and safe workplace environment. I'm just going to skip to the next slide, but it's also very important for us to have, evidence-informed, common language around these definitions. And so, according to our national standard on psychological health and safety in the workplace, psychologically healthy and safe in the safety in the workplace is systematic support provided within an organization and within teams to actively prevent and minimize the risk of psychological harm from work-related causes and to promote mental health. So psychologically healthy and safe work environments help address the root causes of psychological stressors. And so this is really important. So if we can all get on the same working definition of what this means based on the standards, it makes the solutions all the more clearer. And so I'm going to bring your attention to what are the national standards. Well, initially they're called the 13 factors, but they've added two additional factors for healthcare workers specifically. But I'll just introduce you to the first 13 and then talk about the two. So the first one is having an organizational culture that promotes and prioritizes psychological health and safety of everyone across the organization. Access to psychological and social support. I think somebody mentioned that in the chat. Having clear leadership expectations, really important. Civility and respect is huge. I think that's the first thing that frays and falls apart when teams and workers are under duress and stress. Prioritizing, balancing psychological demands that come through the workplace, providing opportunities for growth and development in people's career is super important, and recognition and reward. That's huge, right? And so in healthcare, we have a little bit of an ethos of like, we do it because, we're just good people. And, but, if if we were in any other sector, there is recognition and reward that also recognizes your contributions and recognizes and rewards you in your steps to go above and beyond. And that's not just monetary, right? It's opportunities and simply being recognized. Having involvement and influence in decisions regarding your work and also decisions across the organization. Workload management, very essential. Ensuring, safe workloads and safe staffing, and ensuring that the organization has engagement with staff that's mutual and collaborative. And a few people put this in the chat, the balance, right? So being very attuned to the work-life balance of your workforce and offering psychological protection from work-related psychological risk. Just like we offer PPE, personal protective equipment like masks and gowns, we need to have psychological PPE when we know workers are going to be exposed to potentially traumatic or secondary trauma. And then equally, protection of physical safety. And I think we do better in protection of physical safety in terms of occupational health. We just have to do better at psychological protection as well. Now, recently, the standards have added two additional factors specifically for healthcare workers. And those two are, the first one is protection from moral distress. And that's because, first responders, healthcare workers, anyone who works in the health system is at higher risk of moral distress and moral injury. The second addition factor is providing tangible support for psychological safe care. And that includes mental health literacy, that includes team-based supports and access to tangible support. And these 13 factors align with very foundational work by Swenson and colleagues. They call it the joy at work. Their work was so foundational that the Institute for Healthcare Improvement adopted it as the joy at work framework. And so why this framework is so important is, okay, those sounds like great ideas. Like who would disagree? Let's prioritize civility and respect. Yes, we do need to recognize and reward our staff and protect them from psychological harm. But how do we walk the talk, right? How do we move from big values to action? And so the Joy at Work framework really kind of focuses on the key actions. And the first one is design organizational systems to address human needs. So the healthcare system, in terms of structures and processes, need to put the human needs of workers as the center. Often we focus on patients. Of course, that's always going to be the case, but we neglect designing systems that work for workers. Develop leaders with participatory management competency. So we're not just operations focused, but people focused. How do we lead teams through crisis? How do we create environments that are psychologically safe? What supports do our leaders need to grow those leadership capacities? And build social community within the healthcare organization. And if you look at the IHI Joy at Work, they offer concrete actions, simple as commensality, which means sharing a meal, building peer support, communities of practice, building real community at the workplace. Remove sources of frustration and inefficiency. And we all know there's lots of that in healthcare structures. Reduce preventable harm and support secondary victimization, so vicarious trauma, secondary stress, and bolster individual wellness. And so why this matters is the key kind of enabler to actioning these concrete actions to promote a more psychologically safe um, organizational culture is the key role of leaders. So, research has shown time and time again the pivotal role of senior leadership championing that we as an organization value and are committed to psychological health and safety and creating a culture of joy at work, and not just saying it, but really taking concrete action to prioritize it in the strategic plan and really putting it into accountability, right? So if something has no accountability, often has no follow through. And then there's the pivotal role of managers and teams. Research during crisis shows that the first person somebody goes to for help when they are in distress at work is in fact their immediate supervisor. And the quality of engagement and support that they receive from that moment when they're reaching out to their supervisor or team leader determines the outcome of how distressed or how capable or supported they feel. But in order to do this, we need to support our leaders who are also overstretched. And so tangible actions, HR logistics, community of practice, corporate wellness strategies that really highlight leadership capacity building really do matter. And at the individual level, you have your standard employee family assistance programs. But we miss the mark because are people actually using them? Are there certain barriers there? How can we make this more easier for folks? We talk about work-life balance, but what would be the tangible actions that we could do at our workplace to really promote that? And how do we create a supportive network that connects the person to what they need so that the burden is not on the individual? Now, why does this matter? Because workforce resiliency is essential to organizational resiliency. And so the reality is human resources and time are finite. You can't grow healthcare workers on trees. You can't just replace one peer worker. These are valuable resources in our system, and we need to treat them as such because, we live in a different age right now. There's multiple unknown crises around the corner, and not to fearmonger, but we need to be ready for that in a way that we can work through it, right, together. And that means that we can't rely on our usual crisis response that really is like surge capacity and then burnout. We need a marathon approach. And then so our approach needs to shift from a wellness strategy. So often, years before we're like, oh, our staff are burnt out, where they're having moral distress. Let's have a wellness day, or let's bring in mindfulness, which is great. That's at the individual level. But if you really want to build workforce resiliency, it's not going to happen through a wellness program. So when I started my PhD journey examining trauma-informed culture, people didn't know what I was talking about because whenever you say trauma informed, in my experience, and this was 10 years ago, people thought like PTSD. Oh, you're studying PTSD and you're studying like traumatized people. And I would be saying, no, that's not what it's about. Like trauma informed is not about the trauma. In fact, it's about psychological safety and all of us feeling safe, to be quite blunt. And it doesn't matter. I call it small T's and big T's, small traumas, big traumas, whatever it is, as human beings, trauma experiences of trauma are prevalent. And it's kind of like calling the elephant out of the room. And, the purpose of being trauma informed is not to heal trauma or to delve into that. It is actually the opposite. It is the purpose of being trauma informed is to acknowledge, yeah, we all have experiences that are potentially traumatic because trauma is prevalent, but we want to make sure everyone feels safe. And so, what's interesting is I've seen a big shift in public consciousness on the understanding of trauma informed culture. And that in the last 2 years, I'm seeing in places like Harvard Business Review, uh, we need trauma informed workplaces. An entrepreneur, this I was so shocked. They had an article, Are you a trauma responsive leader? Why trauma informed leaders make a happy and healthy workplace. And then for sure, Kaiser Permanente, the new workplace is trauma informed. And this was all in the last, 3 years. And people's understanding of trauma informed culture has really kind of come to fruition to understand that we need to create cultures of care. And so, what does a trauma informed organization look like? What does that mean? Well, in trauma informed organizations and cultures, people realize the prevalence and widespread impact of trauma. And so that's one. We realize it and we acknowledge that. And then we work in ways to recognize the signs and impact of trauma. So we try to recognize how trauma affects everyone involved, caregivers, patients, communities, us as workers. And then we try to use that recognition and realization to respond in ways that fully integrate that trauma informed knowledge into our policies, procedures, and practices so that we don't uninadvertently, so inadvertently, without knowing, because we all have blind spots, re traumatize people, including our workforce, in routine processes of care. And so we try to create a system where we resist re traumatization. And so, what are the core principles of a trauma informed approach? First is acknowledgement. It's super powerful to acknowledge when things are bad, when we don't have clear solutions. And that's powerful. You don't need to have the solution. You don't need to unpack it. But just being heard, seen, and acknowledged is so powerful. And that's the number one thing that research has shown, that leaders who are just able to acknowledge, like, this is a difficult situation. I see you. I don't have the solution. That is so powerful to people. And then the second principle is prioritizing safety, psychological, emotional, physical, of everyone involved. And I think in healthcare, we're so patient focused, like patient safety, as we should. We forget that in order to provide safe care to our patients, we need to make sure that our staff who provide that care are supported and feel safe. The next principle in a trauma informed approach is the essential value of trust. And from a trauma informed worldview, trust is earned. And so this is a double faced coin. You have to earn people's trust, but also when trust is broken, it's very hard to earn that trust back. And this is really important for organizational leadership because when our workforce breaks trust with us, or we break trust with them, actually, it's hard to earn that trust back. And so we should try to always work in trustworthy ways. Offer choice where possible, even when there's no choice. And that's being transparent. I'm so sorry. I wish there was another choice, but this we don't. But what can we do given these limitations? And then the next principle of a trauma-informed approach is being relational and collaborative. And that's because relationships matter. That means we have to invest time and resources into processes that foster healthy workplace relationships. And then finally, the another kind of core principle of a trauma-informed approach is shared power. And so working in ways that share power and shifting away from like a hierarchical power pyramid. And we do this because we want to achieve the goals of a trauma-informed organization, which are to realize the prevalence of trauma, recognize the signs of that impact, and respond in ways that reduce re-traumatization. And so pragmatically, what are the concrete actions that can lead to a trauma-informed culture? First is, I'll just kind of use my cursor, is The first row shows all the trauma-informed values and principles. So acknowledgement, safety, trust, choice, shared power, relational, and collaborative. So what you do is you do an organizational audit or inventory of assessing to the degree to which these values are embedded and evident in your program procedures and settings, in your formal service policies, and administrative support for program or organizational wide trauma informed services for both clients and staff, the degree to which there is trauma screening, assessment, and service planning for clients, but also if I was, um, in occupational health, the degree to which we do that for our staff, and then providing organization-wide staff training and education, and the degree to which these values are incorporated in our human resources practices. So, this is not a one-off. This is a multi-year strategy because you can imagine each of these domains are quite big. And so it's a long game commitment to creating a trauma-informed organization. And so, what are some pragmatic tools in the here and now, individually in our interactions, whether you're a manager or a peer support worker or a nurse or a frontline care provider? One trauma-informed process is this three-step process called awareness, acknowledge, and make space. And so the whole idea is sometimes, because we're human, we're all human, we have a fight or flight or freeze response when we're overwhelmed or confronted with challenge. And so before we do that, we want to kind of train ourselves to kind of go towards the first step, which is pausing, just making time to kind of reflect on what comes to our initial awareness. And that includes reflecting on potential impacts, awareness of our impact to the situation, and awareness of threats to safety and control for myself, but everyone else involved. And so this is just pause and just what comes to my awareness. And then the second step is what can we acknowledge in this situation for myself and others? And so acknowledging things that are going on for me, but also things that may be going on for other people involved. And also acknowledging the discomfort and distress that I'm experiencing now, but also potential discomfort and distress in others. And acknowledging our shared vulnerability. And hopefully, this kind of pausing, slowing down will allow us to create some space for discomfort. And so making space for unease. And this is a very trauma informed approach to kind of moving away from reacting to becoming more responsive. And so, what we hope from a trauma informed culture approach is that we start to shift away from what's wrong with this person, what's wrong with this department. And I've done it a lot of times because when something happens, and you're especially in conflict, you're like, oh my God, I can't believe Rosie's doing that again. Like she's so difficult. Like, what's wrong with accounting? What's wrong with them? And so it's natural and actually okay to do that because we're human. But what we want to do is we want to shift away from that. And we want to use this trauma informed lens so that we can shift away from what is wrong with the person, what's wrong with the situation, department, toward what's happened, what's going on. And that really kind of shifts towards a trauma informed lens. So some practical tools and strategies to kind of foster a trauma informed culture, a culture shift that facilitates from burnout to balance. Some ones that are really good that I want to highlight. One is from Healthcare Excellence Canada. And research has shown over decades that peer support matters. Peer support in the workplace really matters. And often in healthcare, we don't do a good job of that. We don't do a good job in peer support at all. But, across the board for our patients and caregivers, but often we do even worse on peer support amongst our workers. And so Healthcare Excellence Canada has created a wonderful guidance creating a safe space, psychological safety of healthcare workers, peer-to-peer support, and other support models. I think it's a fantastic resource. Um, Another excellent resource, I really encourage everyone to check it out, is led by Dr. Ivy Bourgeot and her team from the University of Ottawa. It's called the Health Worker Burnout Toolkit. It is a beautiful repository of evidence-based tools that you can employ in your workplace to foster actionable interventions to address burnout. Excellent toolkit. And they've done the work for us and really kind of organized the evidence in this beautiful toolkit. And then the last one is a toolkit for the long-term care sector that a team that I'm leading is working on. It's called the Building Psychological Health and Safety in Long-Term Care. And these are a repository of best practices and evidence to support psychological safety and trauma-informed culture specific to the long-term care. So those are some resources. Here's a QR code to the long-term care toolkit. And these slides will be shared with folks after the webinar. And I think I'm good for time because oh, wait. I promise this is the last slide because I really want to make sure we have that 15 minutes for Q&A. But, a personal action plan is also important. I know I talked about organization level and culture, but for all of us, whether we're managers, peer support workers, caregivers, frontline providers, it's good to have a personal action plan for our well-being. Checking in with myself and connecting, and check in with others. Check in with your colleagues. Have a pulse check on the symptoms of burnout. Now that we all know the actual definition of burnout, just doing a kind of pulse check on where I'm at, and then address the root causes of burnout. And if I'm burning out because my workload is too much, no amount of self-care spa days is going to help. So we need to have a conversation with our director or our manager about workload. We have to tend to mental health and well-being, and tend to physical, emotional, and spiritual well-being, and connect to resources and support. So this is on a personal level. And now I'm really pleased to have time for Q&A. So I'll stop sharing the slides and open it up.
Yeah, so if you have any questions or comments or anything, just put them in the chat or the Q&A and we can get them answered right now.
Yes,
Yeah,
go
just
ahead.
look for these handouts. They will be in the follow-up email. Do you want to just put the resources in the chat, Rosie, just so they
Yeah, I'll look up the websites now, and then health worker burnout toolkit and such. And while folks put in their questions or reflections, I just have there we go.
I see someone put in the chat, when you have expressed concerns to an employer about your workload and workplace environment that are contributing to burnout and nothing changes, what are your options other than self-selecting out, i.e. quitting, going on leave?
Very good question, because I think all of us have found ourselves in that position. And then so, yeah, one thing is you did the right thing. So first step is having a conversation about workload with my immediate supervisor. Very important. And that first conversation is important, but how that ends might not be the way we expected. And so it behooves us, um, again, try the conversation again, but also I think one of the take home message from today's dialogue is workplace psychological health and safety. The 13 national factors point clearly to the importance of workload. And so this is no longer a me issue. If it's a workload issue, yeah, it's a me issue because I'm the one burnt out, right? So for sure that part is a me issue. But the root cause, the workload issue, I think is an everyone issue. And it probably, if I was a manager and a supervisor, that is part of my operational domain. And so if we can articulate that workload issue, which is an everyone issue that ultimately affects patient care, I think that creates space. And this is why I think that three-step approach might be helpful. You know, pause, what comes to my awareness, what's going on with the situation uh, for me and them. Second is what do I need to acknowledge? It could be that we're under funding cuts. Maybe our whole organization is in deficit. Maybe we use too much agency staff. Whatever structural things might be going on. Also, this kind of understaffing that leads to overwork probably is a root cause driver beyond your supervisor even, right? So if you look at an organization, it's not any one person that's creating a problem. And so I think when we start to, I know it's very hard because if we're the one burnt out, when we are able to not make it personal, we're able to create some space. And you know what? The space is in reality, there's no easy solution. It's not like, if we're under budget cuts, those cuts are going to be reversed, or there's no miracle that, we're going to get full-time staff. But I can hold that discomfort and perhaps be able to have a real, authentic conversation about the issue. And the issue is workload, right? It's the workload that's causing the burnout. And I think when we're able to get to that common, you know, shared prioritization, that conversation is very powerful. So then it's not about me, Rosie, like was stressed out and burnt out, that's really important. But it's really about there we have a serious workload issue. And I'm sure you as a manager, that's your priority, it's my priority, and we're on the same page on this. And I think that creates an opportunity that perhaps isn't there when it's about me. I know it's not a good answer, um, but I think that's the shift toward a trauma-informed approach, that we're shifting away from what's wrong, to like, what is happening here? Because, in an organization, it is a food chain, right? Because it's probably a bad term to say food chain, but like your manager is reporting to a director who is reporting to a senior director, and there's this like cascade of multiple pressures to do more with less. And so, how do we come to a common shared prioritization? Because I think we can all agree this workload is an issue that needs to be addressed.
Rosie, do you mind sharing that slide with the burnout toolkit just while we answer some of the rest of the
Oh
questions?
yeah, yeah. I'm gonna.
I do have
Sorry.
a couple other
There you
questions.
go.
I'll let you share
I'm
that.
gonna put the link into the chat now. The Burnout Toolkit is amazing. And then I'll put the link to Healthcare Excellence. Yes, and then I'll put the third link to our long-term care toolkit for folks too. Um, I'm so sorry, I'm very bad at multitasking. So I'm going to rely on Carissa to help with if there's any other questions. So here's the healthcare excellence one, and I'll do the long-term care toolkit.
I'll wait till you paste that. That'll.
Oh, okay, great. Thank you. And
We
I'll
do.
paste that.
There's a couple other questions in the chat here. Um,
Copy. There we go. Voila. And here's the our toolkit our team has done to support long-term care, which you want to talk about, you know, inequities in funding and resourcing even within healthcare. Long-term care has been chronically under-resourced and has very specific workplace related concerns.
Yeah, so there is a question that has been echoed by a couple people here, and it says, as a worker, how can I encourage management to implement these ideas? I'm feeling very powerless outside of what change it can affect within myself and the support I can provide my coworkers.
Oh, that is such an important question and something that resonates, I think, with all of us. So thank you to the person who raised it. I think what I found helpful is using the frameworks and guidelines that exist. So, and I think I call it the coffee table book example. Like, those fancy magazines people have on their coffee table, but whoever comes to your house or place, it becomes a point of conversation. I would highly encourage using the 15 factors, the national, Canadian, psychological health and safety in the workplace factors as your coffee table book conversation piece. So, for example, I've done it. So that it's a very neutral talking piece. Like, folks, have you seen the national guidelines? Did you know we have psychological health and safety factors? And you'll sound like I sound like a total like nerd, but I'm like, we have these are safety factors. Did you know that in the tech industry and in finance, even not even healthcare, this is normalized? And did you know that the framework has concrete actions? And I think that provides a very concrete conversation piece about implementing these factors. And you know what? I'm throwing healthcare under the bus a lot in this hour, but I have to give credit where it's due. Uh, Healthcare organizations care about their workers, and we are healthcare organizations, actually. We, we the workers, and we care about it. And so, um, implementing occupational health and safety committees is a good example, but we can use these occupational health and safety committees as a mechanism to action these psychological health and safety, I would say, standards. They're factors, but they're standards. And that's a very concrete way to engage people in it and not make it about individuals, but about just like PPE, or like electrical hazards in your office, right? Like these tangible things uh, make the actioning easier for people because then it's more concrete, right? It's not something ethereal or hokey pokey. It's like, actually, we have national standards and they have guidance on this. And the Institute for Healthcare Improvement has a Joy at Work framework, and these are concrete leadership actions.
Yeah, for sure. Sorry, I just see that the links were just sent to host, so I'm just copying and pasting them again for everyone. Should be available now. And maybe I'll do this as a last question since it follows up pretty nicely to your one that you just answered. Someone asks, as a people leader, how can I effectively apply the concept of psychological safety when leading a multicultural team with diverse perspectives and cultural norms, especially when team members may have different ways of expressing ideas or concerns?
Oh my God, this leader is already trauma informed. So the fact that you're asking this question, oh my God, aligns with the values. So you recognize and acknowledge the diversity in your team, uh, which is very powerful, and which means you're open and you acknowledge that. And there's not one way to do it. What the research literature shows is that in terms of people leadership, when you look at the trauma-informed principles, being relational and collaborative, being trustworthy and transparent, being prioritizing psychological safety and acknowledgement, when leaders demonstrate that in the ways that they engage with their team members feel it. And that's very powerful because at the end of the day, all of us want to be seen and heard, right? And so um, the fact that you are attuned to that your team is diverse, that we all come from our own lived experience and intersectionality and ways of understanding tells me that you are a trauma informed leader because you see that and that's probably going to show in the way you engage your team because you're probably going to be very open and you're probably going to acknowledge discomfort rather than shut it down. That's another thing. Good people leaders, they don't shut down discomfort. They don't shut down conflict. They, in fact, are comfortable and navigate people during conflict, during, differences toward being together, right? Making sure that, yeah, we disagree, but we're going to be civil. I'm still respect you. And even though we disagree on this and we have a conflict and we have different cultural beliefs or values, I fundamentally care about you and your safety and my safety. And I'm not going to behave or work in ways that breaks trust with you.